Needle and syringe procedure. Start by performing your 40 to 60 second hand wash. Call your patient. Greet them in a friendly manner and tell them your name. Ask for their referral and Medicare card. Once you have looked at the test that the doctor has requested, ask them if they are happy to continue. For example, your doctor has requested for you to have some blood tests. Is that okay? Once you have consent to continue, you need to formally identify your patient. Ask them to please spell their surname. Can you please spell your first name? What is your date of birth? Can you please tell me your address? What is your best contactable number? This is usually a mobile phone number. We need to ensure that the Medicare card details match the name on the referral and fill in the Medicare card number if the doctor has not already done. Ask them if they are seeing the doctor that is written on the referral. We need to confirm the address of the doctor's clinic so that they get the results. Sometimes there is a copy to doctor. We also need to check those details so that they also get a copy. Some tests require pre-test criteria questions. Some tests require fasting. Some tests require the patient to withhold medication, and some tests require the names of medication that they are taking. Fill this information in the clinical notes section on the referral. We are now ready to start the procedure. Start by sanitizing your hands and apply the tourniquet and palpate for a vein. Once you have selected a vein, loosen the tourniquet. Sanitize your hands again. Gather your equipment into the kidney dish. You will need 5 things: tubes, syringe, needle, cotton ball or pozzolan, and lastly, we take out the alcohol swab and we go straight to the patient and swab the selected site. We then leave the swab on the patient's wrist. We now need to assemble our equipment. Prepare our tubes by loosening the lids to make it easier to take off later. Open the syringe packet slightly and purge the plunger while still in the packaging. Remove the white lid of the packaging so that the syringe is resting in the clear packaging. Open the needle, ensuring we do not touch the hub. This is the part that connects to the syringe, so we don't want to contaminate that. Look for the bevel in the needle. This is the eye of the needle. Line it up with the numbers on the syringe and connect the needle to the syringe and slightly twist downwards and to the left. The bevel should now be to the left of the numbers. Place the syringe down in the clear packaging. Apply your gloves and place the kidney dish within reach. Retighten the tourniquet. Pick up the syringe in your dominant hand with a pistol grip. Walk over and stand in front of the patient, standing in line with the vein. Touch the swab and repalpate the vein again if needed. Uncap the needle, ensuring the bevel is facing up. Anchor the vein by pulling the skin back. This should be done approximately 10 centimetres away from the site. Warn your patient there might be a sharp sting. Insert the needle and ground the back of your fingers against the arm for stability. You should see a flash of blood in the hub of the needle if you are in the vein. Gently pull back the plunger. When you have established the blood flow, loosen the tourniquet. Use this time to look up at your patient and ensure that they are okay. Continue to pull back on the plunger until you have the desired amount of blood. Pick up the cotton ball or pozzolan and hover over the needle in the arm. Never put pressure on the needle while it is still in the arm. As you exit the needle from the arm, you apply pressure with the cotton ball or pozzolan. Ensure the needle is away from both yourself and the patient and ask them to apply pressure. You need to discard your needle straight away with only one hand. Pull back the plunger slightly to prevent any blood drips. Insert the needle into the sharps container hole at the top. Lock it in and rock back and forth to lever the needle off the syringe. Remove the lids off the tubes and carefully decant the blood into each tube, ensuring you take note of the fill lines and the order of draw. Discard the syringe. Replace the lids on the tube and invert. Label the tubes and ask your patient to check the spelling is correct and the date of birth. Place the tubes into your biohazard bag. Check that the patient has stopped bleeding and apply a dressing. Give the aftercare instructions and remove the tourniquet. Ask your patient to sign for the Medicare form and wish them a good day. Tidy up your workstation and complete your referral, barcodes and day sheet, placing the referral in the front pocket of your biohazard bag. Remove your gloves and sanitize your hands. Place your bloods in the processing area and wash your hands with soap and water. You are now ready for your next patient.